I'm Courtney. I'm a pelvic floor physical therapist from Pelvic Health and Rehab Center. Today we're going to go over the top 5 exercises that you can do with an IntelliRoll or foam roller to help with pelvic pain. So the first exercise we're going to do is for the quads or the fronts of the thighs. So you're going to put your quads in the grooves of the IntelliRoll. And then you're going to come onto your forearms. Your toes can be touching down onto the ground if you like. And then you're going to shift your weight over your forearms and back in a smooth, slow motion. Remember to breathe. And you should feel this going through both quads and the front of the thighs. If you find a spot that feels a little more tight than the others, just pause over it real quick and just do very small motions back and forth. You might even kind of bend one knee with it and straighten it back out. And you can go from the bottom of the pelvis all the way to the top of the knees. Okay, next we're going to do the adductors or the inner thighs. So you're going to turn the IntelliRoll so that it's parallel with your body. You're going to put the IntelliRoll a little bit further down and bring one knee directly out to the side, and now your inner thigh is going to be right in that groove. And then here, again, weight onto the forearms, and you're going to shift now side to side so that you roll through the inner thigh all the way from the pelvis down to the knee. And again, pause over any areas that feels a little more tender than the other. And here you can, if you need to adjust and move the IntelliRoll, or you can bring the knee further up or further down to get different angles. Next, we're going to go onto the IT bands or the sides of the hips. So we're going to put the foam roller back this way. You're going to turn onto your side and place your thigh in one of the grooves, and the other foot crosses in front of you so you have an anchor and a balance point. And now you're going to shift your weight up and down, rolling again kind of down to the knee, up to the hip. Be careful not to roll directly over the hip bone on the outside, but otherwise roll all the way that length. And you can turn your body a little bit more in or a little bit more out to get a different angle. And sometimes this one's more tender for people, so if it's a little bit too much for you, really use that other leg to lift your body up a little bit and use your forearms to take some pressure off of that thigh. Okay. And then next we're gonna get the glutes. So you're gonna turn and sit on top of it, and you're aiming to get the tailbone kind of into that spinal groove in the middle. So you have glutes on both sides. You're going to put your hands behind you, and you're going to use your body weight again to just shift back and forth, rolling over the glutes. To get a little bit deeper, you're going to cross one leg over the other, and you're going to shift and roll over to the side that you have crossed. So here I have my left side, and then you can roll up and down to get a little bit more specifically onto that glute. And again, you can kind of pause and maybe rotate back and forth this way to get a specific spot. And from here, you're going to come down onto the mat with the foam roller behind you. You're going to place your spine in that spine zone in the middle. You're going to rotate to one side, so again now I'm towards the left, so that you're going to get the muscles along the spine, the paraspinals and the QL muscle a little bit more into the groove, the body zone. So you're going to shift over to the side, pick up your hips a little bit, and then shift using your forearm and your feet. Shift forward and back so that you can release into paraspinals and the QL. And again, finding a more tense spot, just go nice and slow, small little movements back and forth over that. So those are the top 5 ways that we can use the IntelliRoll or foam roller to help with pelvic pain. I like to use the foam roller about a minute, maybe 2 on each section that you're working on, so kind of 5 to 10 minutes in total. And you know, if you have a spot that you know is a little bit more tender or tight for you, you can focus on that area rather than some of the other ones. And if you're looking for a little bit more specific instruction, you can check out the individual videos for quads and adductors, for the IT band and the TFL, for the glutes, and for the lower back.